Thank you for joining us today on Aesthetic TV. Today we will be taking a look at what causes wrinkles and how they can be fixed. As we age, we experience a breakdown of collagen and elasticity in our skin primarily from sun damage, and we naturally lose some of the subcutaneous fat beneath the skin. This loss of volume loosens the skin and contributes to an aged, saggy face. The effect of that is areas around the mouth and corner of the mouth can make you look unhappy. Luckily, today there are a variety of things that we can do to deal with the effects of aging. Joining us from the University of Washington faculty is Dr. Phil Werschler, a board-certified dermatologist. Thank you so much for being here.
Pleasure.
And Dr. Louis D. Joseph is a board-certified facial, plastic, and reconstructive surgeon practicing in Atlanta, Georgia, and is a clinical instructor of head and neck surgery at Emory University. Thank you so much as well.
Pleasure to be here.
Now, Dr. Werschler, now that we have a better idea of what causes wrinkles, can you please tell us what can we do to really fix them?
Yes, Stuart. There are things that we can do to diminish the appearance of wrinkles. Neurotoxins and fillers, for example, are two non-invasive treatments that are commonly used to improve the appearance of our skin. Where neurotoxins are generally used on the upper part of the face, fillers do a great job treating the lines and wrinkles that we often see in the lower face.
And today we're discussing dermal fillers, which I'm not sure if everyone watching this knows what a dermal filler is.
Well, very simply put, Stuart, dermal fillers are injectables that are used to fill the area underneath the skin. As we age, our skin inevitably loses its youthful appearance as the production of natural dermal volumizers and moisturizers just diminish over time. So inevitably, it leaves lines and wrinkles in areas where our skin was once youthful, smooth, and radiant.
So Dr. D. Joseph, can you give me an example of a filler?
Well, Stuart, there's many different fillers available these days to the consumer, and one of my personal favorites is Radiesse.
So what kind of filler is Radiesse?
Radiesse is a volumizing filler. When injected under the skin, it works by immediately restoring facial volume to smooth out the signs of aging with natural-looking results. With Radiesse, it is possible to treat different areas of the face, such as the smile lines, marionette lines, corners of the mouth, chin, and even the pre-jowl folds. So targeting these 5 areas may help lead to a more revitalized appearance and a more youthful, refreshed looking you. It also stimulates the production of your own natural collagen, which is wonderful. This gives natural looking results that may last over a year in many patients.
In terms of the specific products that I use, I find that Radiesse, which is approved for moderate to severe wrinkles and folds like smile lines, is a very good option for areas that need lift due to volume loss. It also is a very cost-effective option for the patient.
Okay, so if I had a Radiesse treatment, when could I resume my daily activities and get back to regular life?
Stuart, it's a great question. I always counsel my patients that either that evening into the next day with a little makeup on the area, they should be good to go and get back to their daily life activities.
Well, that's really great that there's such little downtime. Now, I've also been hearing a lot about another product, Bellatero Balance. Is that also a volumizing filler?
Well, Stuart, while Radiesse is typically used for deep filling and adding volume to wrinkles and folds, Bellatero Balance is a dermal filler that is an ideal choice to soften and smooth moderate to severe etched-in lines and wrinkles.
Bellatero Balance completely integrates within the skin tissue, which is important in areas such as stubborn, etched-in facial wrinkles. It is able to help smooth these lines while maintaining normal movement and facial expressions. It also feels very natural to the touch once it integrates into the skin.
Now, what led you both to use Radiesse and Bellatero Balance in your practices?
Well, Stuart, it's the combination of the deeper, more severe wrinkles and folds that need a product that is going to be able to have the strength to lift those out and hold them, and then the more superficial etched-in lines, which need a different type of product to smooth those out. So it's really a combination of products for a combination of different folds, lines, and etched-in lines.
So can you use Radiesse and Bellatero Balance together on the same patient?
Well, mixing and matching of fillers is an art. Using Radiesse and Bellatero Balance to treat different types of wrinkles and folds can help address the patient's aesthetic needs for overall lower face rejuvenation.
Anything you'd like to add, Dr. DeJoseph?
Well, I echo what Phil just said in that both these fillers do different things for us, and they really add a nice extra tool for us to accomplish what our patients would like to see.
So this is all very interesting. Now the big question, how long do Belotero balance sessions take?
Not very long. As Dr. Joseph said earlier, the process is really the same for dermal fillers. The patient comes in, photographs are taken, the skin is properly prepped and prepared, the patient is treated in the office, and typically within 60 to 90 minutes, the patient is ready to leave and get back into regular activities.
So what about downtime and any complications that we should know about?
Well, Stuart, downtime is about as minimal as it gets from these treatments, considering the amount of bang we get for the treatment. I tell patients, plan on a day or two of a little bit of bruising, maybe a little swelling. But for the most part, back in your makeup, back up to your daily activities that evening and the next morning.
The most common adverse events with Radiesse include bruising, redness, swelling, pain, tenderness, and itching. These side effects generally last for a short time and are very mild in nature. More rare side effects that may include swelling that lasts longer, unevenness or firmness in the area injected, and as with any injection, there may be a risk of infection. However, with proper preparation and injection technique, the occurrence of major adverse events can be minimized.
Now, in a moment, we're going to have one of Dr. DeJoseph's patients join us. So right now, we're going to put up a photo of her before look. Now, Dr. Werschler, tell me about this. Comment on this for us.
Well, what I see here is someone who has a very lean face. And that leanness is a loss of volume. And the volume has resulted in these folds that we call nasolabial folds. They run from the corner of the nose to the corner of the mouth, and there's some folding under the corners of the mouth, what we call the oral commissures, and some volume loss in what we term the marionette lines just below the lower lip. So my thought would be here that the ideal rejuvenation would be a combination of using some fillers like Radiesse to lift and support the nasolabial folds, and then for some of the smaller etched in lines like at the corners of the mouth, using some Belotero. That would be my treatment plan.
Well, I'm excited to see Nicole, and joining us right now is Dr. DeJoseph's patient. Nicole, come on out. So great to meet you. You look wonderful.
Great to see you.
Good to see you.
Thanks for coming.
Wow.
Thanks for having me.
So Nicole, tell me, how was the treatment for you?
It was more than I could have hoped for. I feel like I saw an immediate difference, and I really love that it was subtle and natural looking, and I just feel like I look more refreshed and great for my age now.
And how was your recovery?
I really don't even feel like I had a recovery. I mean, the procedure was so simple and so easy, and I was comfortable, and I think it turned out great.
And now for the big question. Are you happy?
Oh, I'm so happy. I'm so happy. Like I said, it was more than I could have hoped for.
Well, I have to say that Nicole's outcome is just amazing, and this must be the artistry you were talking about. Compliments to you.
Thank you very much, Stuart. Thank you. I'm only as good as the patient. She's a beautiful, beautiful
No.
woman, and just was really, really very straightforward. She was already pretty to start. So.
Oh. Well, I had the best, so.
Yes, you, clearly.
And as one colleague to another, I think that it looks fantastic. And Nicole, you're beautiful, and it's very natural looking. I think you did a fabulous job, Dr. DeJoseph. And I think
Thank you,
this
Phil.
leads to why we want to choose the right product to do the
Absolutely.
right job.
Yeah, I agree. I think she was the perfect candidate for these type of treatments and really showcased the strengths of the products we discussed today.
I agree.
Well, thank you, Dr. DeJoseph and Dr. Werschler, for explaining what Radiesse and Belotero can do and how they work. And what a great outcome. Nicole, we really appreciate you coming by to show us how
thank you.
fantastic you look.
No, thanks
Thank
for
you.
having me.
Of course, and to learn more about dermal fillers and all the other aesthetic procedures, be sure to visit aesthetichtv.com. For Aesthetic TV, I'm Stuart Brazel. Stay tuned and stay beautiful.